Now to our series of health alerts. Dying to be pregnant. Yesterday, we introduced you to a local woman who had a healthy pregnancy up until 34 weeks. She abruptly developed severe preeclampsia and was forced to deliver her baby 6 weeks early. She spent 3 months in the hospital after giving birth and nearly died.
But her story is certainly not the only one. And Mel, you have another story of a local mom who had a near-death experience and a doctor who believes something fundamental needs to change to keep pregnant women alive.
Yeah, and you'll soon see that Twala's story, the woman you were just talking about, is not unique. Black women are dying at rates 2 to 3 times higher than white women during pregnancy. And there are some very different health risks that differ in these two groups of women. And we talk with that local doctor who believes because of this, the medical industry needs to change. And she introduced us to one of her patients who had dangerous red flags, went to the hospital, was sent home, and still almost died.
That's PJ?
Yeah. Jessica Bazemore is an attorney, a mom to Philip, who's almost 2 years old.
Hi.
He's a busy boy, and this mommy is on it. She was the same way with her pregnancy. Dr. Chandra Adams delivered her baby boy and was also there delivering prenatal care from the start.
So she had an induction scheduled, and we were going for cesarean, and it was uncomplicated, uneventful.
6 pounds, 1.2 ounces, born with a head full of hair. A healthy baby boy, delivered just as they planned. But after he made his way into the world, there was something Dr. Adams noted about Jessica.
Because we saw that her blood pressures in the hospital after delivery were higher than they had been during pregnancy. They weren't technically considered high, but they were higher for her.
Because of that, Jessica was given a list of instructions.
If you feel this way or you feel that way, it is likely to be blood pressures going up.
One of those warnings was difficulty breathing, and that happened to Jessica even before she left the hospital.
I do remember telling the nurse, like, hey, I'm waking up choking. I'm still swollen. I don't know what's going on. And she told me that I probably just had sleep apnea and to follow up with my primary care.
Jessica accepted that answer, but when she got home, it only got worse.
I remember telling my fiance, hey, can you just pick me up some Xanax? I'm having trouble breathing.
He bought the medicine, but eventually took her to the emergency room.
In about 3 to 5 minutes, I was in ICU. I do remember crying because I just gave birth and they were taking me away from my baby.
And when she got there, she was in heart failure.
So that choice literally saved her life.
Absolutely.
Her blood pressure was through the roof. She had severe postpartum preeclampsia, which not everyone knows can occur in the first 14 days after delivery. She's also African American.
Is that always a red flag?
Always, always. It is. African American women are more predisposed to have high blood pressure outside of pregnancy. And so pregnancy is a physiologic stress. It's a physiologic process.
So someone with a baseline risk adds a physiological stress like pregnancy, there's a higher risk for a complication. And while Jessica never had high blood pressure during her pregnancy, that higher reading after she delivered was always a red flag for Dr. Adams.
These are the stories that we're hearing. She was fine when she went home, and then they found her dead. Because what happens is the blood pressures get so high that the fluid backs up into the lungs, and the moms essentially drown and suffocate.
And since Black women are more at risk for preeclampsia, they are more at risk for dying when things go wrong. Dr. Adams believes a change in the way care is delivered for all women will help.
There are protocols for surgical care and infection prevention, but the protocols for maternity and hypertension still leave something to be desired. So I think it's coming, but really what it took was this social pressure of this is happening, let's go back and figure out why. Oh, we know why, now let's figure out how to prevent it.
Jessica now knows exactly what an emergency feels like. And in her case, knowledge is truly empowering.
I'm actually ready to give him a sibling because this is such an enjoyable experience. So now having him, it was all worth it, and I just know what to look out for next time.
A story that's still being written, understanding that not every family gets this second chance. So what can change? Dr. Adams believes a protocol change should include When a patient's blood pressure spikes above 140 over 90 during or after pregnancy, an OB hospitalist or the OB on call would be required to actually come in, review the patient, and then discharge that patient. Change can happen. For example, a joint commission that sets guidelines has already instituted changes to address postpartum bleeding. But Dr. Adams says, again, that did not come without social pressure.